My journey into focusing on mental health issues for young minoritized populations really stems from my identity as a Black woman, as an immigrant. I came to this country when I was 11 years old and I moved to Oakland, California. And I was around a lot of poverty and destitution. And I saw very early on what are some of those structural issues that my co-panelists have discussed, right? How poverty can play a big role in people's overall health outcome, both mental health and physical health. And that passion was some of the catalysts that drove me to want to look at how we address these issues as a physician, but also as an advocate. And when we talk about what we're looking at in this country, when we talk about the disparities and inequities and different outcomes based on who people are, it really comes down to structural racism. And we talk about racism a lot in recent years since the post-George Floyd murder and sort of the national reckoning around our country's legacy of racism. But I think it's important for us to also define it so we know what we're talking about here. So we talk about racism, we talk about structural racism as a really deeply entrenched system in which public policies, our institutional practices, and our cultural representations and other norms work in various ways to reinforce racial group inequities. So this is a deeply, attached feature of our social, economic, and political systems. And because of that, you see the trickle-down effects in all areas, including in mental health. We know that, as my co-panelists have also talked about, when you can't afford to live, this is going to lead to a different outcome mentally. Young people of color, young people from low-income communities who are faced with destitution and poverty or dealing with issues that will lead to a change in how their mental neurobiological state functions. Racism have been shown in various studies, and this is no longer just about, oh, this is the right thing to do, but racism kills. Racism can actually cause adverse changes in your brain pathways that can lead to negative outcomes like anxiety, depression, psychosis, things that we always think about as having other factors causing it. Racism can actually lead to that. It can lead to post-traumatic stress for people and suicidality. And I think it's also important to look at the way it also reduces people's positive mental health. So your ability to have good self-esteem, right? Your life satisfaction, your ability to control and master your life, your overall positive affect with with the world, and your well-being can all be affected because of racism. So for us to tackle the issues that affect young people in this country and around the world, we really have to make sure that we are looking at the ways in which race and white supremacy culture in our healthcare system, in our economic systems, in our political systems have adverse impact in how our young people and adults are living in this country. And you mentioned what are some programs that I want to highlight that are doing a really great job at this. I shared with the panelists when we met earlier about the ECOMA project. This is the brainchild of an esteemed Dr. Alfie Berlin Noble, who created this program to look at how to specifically target youth of color and how to help generate collaborations across different sectors to be culturally responsive to the issues facing young people of color. So it's important that we look at things from a racial equity perspective, right? There's no one size fits all model when we're thinking about interventions. We have to be very, very thoughtful about this. And the colorblind way of doing things, the fact that we think that we can apply different interventions at the same places and have the same outcomes, those are no longer seen as evidence-based. So to be very thoughtful in our work, we have to go to the communities that, like Dr. Lyons Hunter was talking about, talk to them, connect with them, make them the center of our work. They are the true stakeholders in what we're trying to do here. There is no outside external input that can actually be effective if we are not centering our work to those who are trying to serve. And it has to also involve cultural humility. And we have to look at the ways in which we come into places wanting to play savior, wanting to change the world, not always realizing that those people may already know strategies and interventions that could help their communities. So really trying to be thoughtful in how we engage with these communities is so important because we know historically in a modern era in this country, that our healthcare system, much of our systems have done just awful harm, truly awful harm to people. And that leads to mistrust, that leads to their inability to want to engage with us. And it leads to what we know as negative outcome. So we all know that we have clinician, biases when we encounter young people of color. They're less likely to be diagnosed with trauma and PTSD versus their white counterparts, even when experiencing the exact same symptoms. They're more likely to be funneled towards our carceral system, leading to early criminal justice involvement, despite having behavioral manifestations that may have led to treatment if they were white. So we have to look at our own interpersonal and provider level issues, but also our own healthcare and political system and our carceral system, and how they all interface to lead to what we're seeing. And we have to be really thoughtful. And I think it's really important to ensure that we're working with the people that we're trying to serve.